Hello and welcome everyone to Insights. I'm Nnamdi Adipo. The well-being and wellness of medical nurses is front and center this week on Insight as we reflect on the 2025 International Nurses Day, marked May 12 every year. It is a week-long commemoration here in Nigeria, drawing the attention of stakeholders to the critical role of nurses in gaining better outcomes in Nigeria's healthcare sector. And Elizabeth will be on much later in the course of this program. She will be discussing the role of the family in national development as we celebrate families across the globe. Let's begin.
Whatever the issues are,
the National Assembly is constitutionally empowered to scrutinize,
however complex or intricate.
We have involved all the academia, the members of the academia. We have involved the academies.
Be it government policies or in fact any issue of public concern.
Our job is to help you gain clarity and make sense of it all.
This is not really healthy for our democracy.
There's a lot of agreements in terms of who has been in power longest and who becomes the governor of the state.
It's also in the quality of food being consumed.
After all, perception is insight.
And gaining understanding is also getting insight.
Let's begin the conversation. The theme for the 2025 International Nurses Day, our nurses, our future, caring for nurses, strengthens economy. It clearly appears to focus on health and the well-being of nurses. You know, according to the International Council of Nurses, otherwise known as the ICN, this theme underscores the critical role of healthy nursing, of a healthy nursing workforce, or the role that they play in strengthening economies, improving health systems, and ensuring better outcomes for communities nationwide, or rather worldwide. As we commemorate this day, we will be reflecting on Nigeria's evolving health care landscape in the hope of challenging stakeholders to re-envision nursing as the cornerstone of an improved healthcare system and also providing nurses with an equitable future here in Nigeria. My guest for this segment is Samuel Olumide Faromi. He is a nurse practitioner and the National Auditor 1 for the National Association of Nigerian Nurses and Midwives. Welcome to Insight, nurse, or should I say comrade, or should I just say comrade nurse? Which one is most appropriate?
Thank you, sir, Mr. Moderator. I'm comrade nurse.
Comrade nurse?
Yes.
Comrade nurse it is. So you are a nurse practitioner as well as being a comrade. So comrade nurse it is. So it is our nurses, our future. Caring for nurses strengthens economy. That implies that the health and the well-being of a healthy nursing workforce, is critical in supporting the overall healthcare system here in Nigeria, or worldwide, I should say. Does that presuppose that isn't the case currently in Nigeria as we have it?
Thank you, Mr. Moderator. First and foremost, let me appreciate Nigerian Television Authority, the management and staff for celebrating with us this year, 2025 International Nurses Day. And at the same time, I bring greetings from the #1 political nurse in this country, in person of comrade nurse Haruna Mama, the national president of our dear association, National Association of Nigerian Nurses and Midwives, and at the same time, our digital general secretary, in person of Dr. T.A. Setima, who is the general secretary of the association, and the other distinguished NAC members. I am comrade nurse Samuel Olumide Faromi, the National Auditor 1, representing the National Administrative Council of NAM at this studio today. So I want to appreciate you, sir. And with the question raised, we are talking about future. That means in the present situation we find ourselves, we have not reached the expected outcome that we are looking at. And we are like over 5 years now, we have been talking about future as leaders, but last year we talked about economy. So this year we are not
Indeed, I was going to say that 2024 was on the economy.
Yes.
But you seem to have already moved on to the well-being and safety, or rather the health and well-being of nurses this time around.
Yes.
Why jump? One would have expected a consolidation of where you were or what you did last year, but you seem to have shifted focus this time around.
It's a continuity, sir. We said we want to strengthen the economy now, because we have talked about...
So there's still somewhat of a linkage.
Yes, there is a link between last year and this year. Because last year we were talking about economy, how nurses can improve and generate the economy. But this year we want to strengthen it, to have it more than what we have last year. And in that situation now, we are looking for the future. How can we compete with the global world in this country? We know we are trying, we know we are moving forward, but comparing with the Western world, we are still lagging behind. So that's why this year we are talking about how to strengthen the economy through caring for nurses. And if we look for nursing profession in the health industry, we constitute roughly 75 to 80% of health workers. So investing in nursing, in their well-being, we strengthen the economy. And we are talking of indirect implication now. Somebody somewhere might be thinking of, we are talking of cash, we are talking of money. No, we are talking of the outcome, the input to the caring of our patient. So we want to strengthen our economy through the well-being, through mental health support, through the good environment for the work we are doing, and provision of the materials needed. And at the same time, compensation for nurses in the country. So through this, we have a resultant effect on the economy. So as we go on, we will elaborate more.
I was hoping, yes, I know you've talked about the future, or rather the target is the future. I wanted you to talk about where we are right now in terms of some of these targets that you've mentioned. You know, you've talked about, in fact, you elaborated, or you inferred the general wellness and well-being of nurses, and then you identified certain objectives. So I would like for you to take one or two of these objectives, but then juxtapose where we are right now with the future targets and objectives, even if it's one or two of these targets, and then we can move forward.
Thank you, Mr. Moderator. Let me first of all appreciate the government of this country for the little they have done in the health industry. But we still have a lot.
Little? It's not plenty?
Well, you know, well, let me say it's still little.
Considering...
Because a lot is expected.
Okay.
Or a lot are expected from our government. But they are doing their own best, but their best is not yet the best to us. Because, let me start one example. When we are talking of professionals, nursing as a professionals, there are a lot of expectations on us. At times, you know what to do, but the materials to do it are not there. I'm talking of equipment and materials to have an efficient nurse. And in that situation, most of our hospitals today are not having the equipment to get the work done as a professional. That's one. Okay. Two, when we are talking of staffing, today,
yes,
if you go globally, there are some critical areas that is a nurse to a patient, and in some wards is a nurse to 4 patients. But in Nigeria today, reverse is the case. You will see a nurse managing 21 patients. You will see a nurse managing 10 patients, and we are looking for quality care.
So understaffing
is a major
and we will still talk about that. Yes. But I mean, since we're on the subject of general wellness and well-being and health of nurses, I would like for us to talk about occupational hazards and how unsafe your working conditions can be sometimes, even including exposure to infectious diseases. There are plenty of stories, and and I don't want to talk or identify some of them, but you are the professional. So I think it's well within the context of this 2025 theme to once again draw attention to the seeming systemic, should I say, neglect on issues like maybe logistics that you've talked about. Working apparatus, maybe like something like the PPEs that we know your nurses, that's the personal protection, equipment now that we know that your colleagues use. I wonder if and how some of these issues that you've talked about, impact or how they undermine nurses' health, and whether they have, and how that also affects their capacity to deliver quality care, in Nigeria across all levels.
Thank you, sir. If you look at the way we operate, nurses are more exposed to injury when it comes to the practice of nursing. For example, you might be thinking of this capping of needle. As small as it is, one can contact many infectious diseases. Let me talk about hepatitis.
Okay.
So if you are not careful, in the course that you want to prick or you want to recap that needle, you can get yourself pricked. And if you are pricked, it might be hepatitis patient. In that situation, now you might contact that infection. And where I'm going is, all these, there are gadgets that we need to have. Like you rightly said that, Mr. Moderator, you're supposed to have PPE, but most of the hospitals are not having PPE. Thank God for COVID-19 that exposed us. During COVID-19, most of these things were produced. But as we are talking today, do we have it sustained in our hospital? So protective personal equipment are highly essential. And at the same time, exposure in the hospital, there are so many ways, like splashing of blood, like a prick that I told you, that environmental hazards, and that's why we need more of developmental training when it comes to in-service training as part of...
Don't you get that intermittently?
Yes, there are some institutions now that are incapacitated with funds. Meanwhile, it's supposed to be on annual basis. In-service training will assist, will improve your knowledge when it comes to what is happening, present, and in the future. We have gone beyond years of archaic practice of nursing.
True.
We are now in the intelligent practice, intelligent way of improving the outcome of our patient.
Are your members in tune with some of these changes that you're talking about? I mean, in terms of some of the trainings you've gotten in the past, are these trainings in tune with changing times? Look, we have AI deployments now in care. In some parts, what nurses do is basically to supervise, and then there are applications in place that aid nurses in carrying out some of these quality delivery services, in the sectors. Are you getting some of that? Are we in tune with the changing times, globally?
Mr. Moderator, sir, we are moving, but we are not yet there. And the pace that we are moving is what we are complaining about. Most of our nurses are highly intelligent, but the major thing is equipment. You see, most of this equipment, like, let me give an example. In the olden days, when you want to give blood,
yes,
you just put it on and give it. But now we are having infusion pump that makes the transfusion faster. So
True.
We are acquainted with all this equipment, but it's the provision of this equipment that is causing issue these days. So if government can produce all these newly or digitalized equipment, it makes the output more of quality than what we are doing presently. And at the same time, things are changing every day.
That's true.
Things are changing every day. So we have to get acquainted so that we'll be able to know the latest management of each of these conditions that we are managing. It's not managing with the old style. And most of us are reading, advancing our academics.
Yes.
In the yesteryear, they say nurses, what are they doing? I can tell you now, professors in nursing are more than 200, 300. We have plenty that numerous PhD holders, masters holders. So it makes you to know that we are improving ourselves academically. But when it comes to clinical side, are we getting the equipment to really do what we are expected to do? So provision of PPE, provision of safety materials in the hospitals are key in our practice. And we need it for us to get, to give our patients quality care.
So you're doing the legwork, you're improving yourselves, you're advising your members to improve themselves, to embark on research. You're getting professors in your profession. You're getting nurses who are nurse practitioners specialized in certain fields.
Yes.
You know, and you're doing all of this work. It brings me to, to the equally important issue of workload and burnout. You know, and what you referenced earlier, the issue of understaffing. I wonder how all of that plays into the mix. If you're having to do more, how does it affect? Does it not affect, how an issue like understaffing, for instance, how an issue like, some of the issues you've mentioned, do they not affect the physical and mental well-being of your colleagues, of your members, and does that not impact somewhat negatively on quality delivery, of your duties and of your operations in the sector?
Thank you, sir. I think I mentioned mental health support the other time.
And I know that some of your members are also given to doing mandatory overtime. That also contributes to the work burnout that we're talking about.
Yes. Thank you. You see, when we are talking of burnout, as I said, that the issue of staffing is really affecting us. And at the same time, when we are talking of the equipment, when we are talking of the way we practice, I told you earlier on that in advanced countries 1-to-1, we have some work that are 1-to-4, but presently now we have workload more. And the work to worsen it up is this issue of moving migration to the Western world. We call it Japan syndrome. It's really affecting us.
So it contributes to the increased workload.
Yes. And what is contributing to this? One, the environmental, let me talk about the environmental issue. The working condition is not well adequate. It will shock you, sir. In, let me say, among the health professionals, nursing is the least paid officer. And
is that true?
Yes, I'm telling you. When it comes to professional, I said professionals in health. When we compare to like pharmacists, the physiotherapists, the doctors,
the lab scientists.
Yes, we are the least paid, and the workload is more on us. And this is what we have been telling the government over 3 years now. But nurses, as we are passionate. We like our patients, and that's why you don't see us embarking on industrial.
You like your patients. Comrade nurse.
Yes, sir.
Okay, let me let you land on what the issue is.
But the issue now is we are moving towards that end. We have been discussing with government. We have visited Federal Ministry of Health. We have seen the Minister of Health and Social Welfare, the Minister of State. We have been discussing with them. But it seems they are dragging foot. And it's really, really affecting us and it's making our people not to be happy. So I'm still telling the government, we love our country. That's why. But at the same time, government is expected to make us happy. For example, that what we are discussing, or what we are demanding, is not far-fetched. There are so many court judgments we have won. They call it industrial arbitrary panel.
Yes.
We talk about the practice of nursing. It's not well implemented. We are telling them, even in the welfare, we are talking about allowances, upward review of allowances, not yet done. We are talking about implementation of some of these allowances. Some, it will shock you now, even when we are talking of core duty allowance, nurses that are PhD, masters are still in the clinical side, but they are the least paid compared to all other health professionals.
You know, you talk about this pay, and nurses being least pay. I will put something to test here with you literally telling us how much nurses earn. But just before I move on, you've unbundled, or you've unpacked, rather, quite a lot here. I tried to note some of them down so that we can come back to them later, especially the part where you talked about nurses like their patients. You and I will definitely talk about that. But just before then, so that we just conclude on this subject of burnout and having very heavy workload. Is it therefore your submission that, policy interventions will be required to address, some of these issues that you've unpacked, especially the aspect of enforcing sustainable workload for nurses and midwives in Nigeria?
Yes, sir. You see, if you go to the hospital today, the number of patients that are coming to the hospital are more. But gradually, the number of nurses are reducing. And whether we like it or not, you have to do the work. So you will see a nurse doing the work of 5 nurses on a good day.
So in that direction, you need government to hire more nurses, more health workers.
Yes, we need government to employ more of this profession. And unfortunately, let me drop it here.
Okay.
Government kept on saying, we don't have nurses, we don't have nurses. We have put it to the Ministry of Health. We have more nurses outside that are not employed, that are in private practice. So government should stop the issue of saying we don't have nurses. We have nurses. Virtually every year, all our schools and departments are turning out roughly 16,000 nurses annually. And these nurses are still in the system. Not all of them have moved abroad, so we are still putting it to government. We did our statistics across the nation. We have the number of nurses that are unemployed and are still within this country. We have 12,575 nurses outside, not yet employed, and they are not even planning to travel. So government will stop the issue of saying we don't have nurses to employ.
Are these 12,000? Are these 12,575? 750.
Yes.
Are these registered nurses
They are
under your
registered
association?
nurses. Yes, they are registered nurses.
But they are not engaged in any public-owned institution.
Yes, sir. So
and they are not engaged in private practice either.
No, they are in private hospitals.
They are in private practice.
Yes, some are in private hospitals, some are.
But you think they can be converted into public
yes,
institutions?
If they are given the opportunity, they are ready to come. So we have many nurses outside as against the issue of they don't have nurses, that's why we are not employed. If all our teaching hospitals today, where they're supposed to have roughly 1,000 nurses, some of them are having 500 nurses, some are having 300 nurses. So it's having a resultant effect negatively on the output we are giving to our patients. And that's what's affecting the burnout we are talking about.
So we do need some form of sustainable workload or a policy or a structure that can enforce sustainable workload for nurses and midwives. You know, we'll talk about the all-important issue of economic inequality and livelihood security. That's what I have called, or what you have referenced as welfare and allowances and salaries and all of that. And I'm sure this is an area that you have a lot to talk about, seeing how you started already. And I said I was going to, you know, say something and, you know, put it to you, or rather make you tell us here and now, so that we can gauge for ourselves if it is true some of what you've said about the wages and salaries of nurses and midwives in Nigeria. What are these wages for? What are the wages for nurses and midwives like at various levels? If you can use figures now and give us and tell us so that we know for ourselves. And equally important that I would like to know is, do your members, something equally important I'd like for you to talk on, you know, do your members have access to health insurance? You know, that's something I'd like for you to talk about. And when you give us these statistics in terms of wages and allowances and salaries across levels, at various levels, what then is your advocacy in terms of economic reforms for nurses and midwives that you think would safeguard their dignity and ensure financial stabilities for your members, you know, in Nigeria?
Thank you, Mr. Moderator, sir. Concerning the issue of health insurance scheme, we are in the program. All nurses in the Federation today that are working with the government are in the health insurance scheme. So that one is settled.
Fantastic.
Yes. Concerning the issue of wages.
Yes.
You see, if we go by the circular concerning shift duty allowance, it says 30% of our basic should be our shift duty allowance. As I'm telling you today, that circular has been in existence over years, but presently, over some years now, government has refused to be paying that 30% when our salary got consolidated. And that makes it lower to other people, other professionals that are on call duty. In the yesteryears, shift duty and call duty are at par, but they have refilled call duty over 3 or 4 times now without even touching shift duty. And it will shock you, sir. Somebody, let me say a nurse, like a nurse anesthetist,
Yes.
who is on call duty.
Yes.
Let me say assistant director, who is on call duty, and assistant director, who is on shift duty. The difference now is roughly 87,000. And in that, it makes those people on call and on shift to be having intra-professional issue. Because I chose to be an anesthetist, somebody chose to be an orthopedic nurse.
Yes.
Be an anesthetist and maybe on call, orthopedic nurse might be on shift duty. And that disparity is causing issue. And that shift duty has not been refilled. 30% is not even complete because it's supposed to be 30% of your basic. But unfortunately, what we are getting at the end of the salary is not up to even 10% of my basic and shift duty. So that's affecting us economically. That's one. 2, when we are even talking about this call duty allowance that we are talking, doctors are collecting 4%. Other professionals are collecting 2%. Nurses are collecting 1.72. Despite the fact that we'll be on duty 24 hours, we'll be with our patient. We are not bringing any other health professional down, but we are telling the public that we need your sympathy. Nurses too, we need to be recognized, remunerated duly, so that we can have that stable emotional support, because that is part of the reason why our people are moving out. When we get there, you know what is happening over there. You have
Is that also part of the reason why sometimes your people are quick to vex? You know, because earlier on you said we like our patients, and then I exclaimed, I said, you like all of your patients. That's not the story we get sometimes from people who go to public hospitals, public institutions, and it cuts across whether you go to a tertiary health institution, or you go to a secondary health institution, or you go to a primary health institution. The story appears to be the same. Nurses displaying nasty behaviors to patients, not being sympathetic with patients. I know, comrade, that you may want to say, and very quickly say, this is not true, but they are there. And before you say, no, they are not there, you remember that even Jesus Christ had 12 disciples, and one of them betrayed him. So what is your agency or your association doing to ensure that nurses are more receptive, more humane? All of your nurses now, maybe not, but most of your nurses are, accommodating of the flaws of patients who are sick, who come to you for healing, for remedies, and then nurses are shouting at them, maltreating them, handling them. We see some of this play out. What has your association done to reverse such a trend?
Thank you, sir. Well, I cannot say we don't have such, as you rightly opined. But what I want to say is, when it comes to caring, there are some things that we need to educate our people outside. That's what we call triad. Triad means sorting of patients in critical environment. Let me give a scenario. If you see, let me say, 5, 10 patients, 3 or 4 of you are shouting, please, assist me, and the remaining one kept silence. Whom will you first attend to? That's where we are having issue. The one that is shouting is still giving you hope of earth. The one that is calm, that is not even shouting, is the one that is dying. So when you are now attending to the one that is dying,
so the one that is shouting might not be an emergency.
It's a sign of good health. When you are shouting, that means you still have strength. But someone is there, not talking. That one is dying. So in that situation, you first of all attend to one that is dying, that one that is shouting. So that's what they call triad, sorting. So that's one. Another area is we are all human beings. Let us be frank with ourselves.
Sure, of course.
When the workload is much, you want to attend. I told you the other time, a nurse is now doing work of 5 nurses now. you and I, we want to be treated. But at the same time, this patient, this nurse has been on duty since, let me say, 8 a.m. for morning duty to 4 p.m. One patient, 21 patients. That's another area. Another area that I want to talk about.
But you cannot condone such a behavior in spite of the workload. Or would your association condone such a behavior?
That's what I'm going, sir. We are having in-service training to our people. There are ways, even when you have burnout, there are ways you fet it out to people, not necessarily be angry. And at the same time, we are doing education, advocacy in that regard. If you look at our association, we have it at state, we have it at the unit. So all of these people are doing advocacy in this regard, that our name that have been known for good should not be put to disrespect. So in that situation, we are having advocacy, we are encouraging them to go for more in-service training where they get more educated. So another area that I want to talk about is our patient too. Let's talk about, let me give an example of delivery room. You see, some of our patients, they were complaining that nurses are shouting. When you want to deliver a baby, the head of baby is out. At that point in time, it's a critical stage. But at times, we say, bear down, bear down. Patients know, especially those people that have unwanted pregnancy. They want that baby to die because it's unwanted. It might be out of rape, it might be out of another thing. So when nurses is telling them, bear down, bear down, bear down, they might be telling you, no, no, no. They might tighten their tie. Yes. So if a nurse now shout in that situation, they say you are shouting.
Actually,
on them.
Some go beyond shouting.
Yes,
they
so
smack the lady.
Yes,
they smack the tie.
It's more of empathetic. It's empathetic. You know, when you are treating your patient, you have to be empathetic too. So in that situation, when the woman is not cooperating with you, that sparking might come on board. Okay. But let me tell you, in all this, we still love our patient. We are advocate of our patient. We talk, we plead, and we advocate for them in all ramifications.
You know, Comrade Nurse, let me give you an opportunity to be emphatic on what you consider the strategy going forward to cope. Something you've talked about, which I consider quite germane and key. You know, when you referenced the understaffing and then you talked about the migration of nurses out of Nigeria based on the environments that they work here, and then the allure and promise of a better society where things work, salaries are better, the tools are available. You know, what is your position on strategies that you think we can adopt yet to retain our nursing talents amid this mass migration, especially also, of course, we must respect individuals' aspiration, you know, the aspiration of a nurse, for instance, to choose to Jakpa if they want. It's their right, after all, you know. But then, you know, there's also that global allure and demand for nurse practitioners outside with, you know, with the enticements of better environment and better pay and all of that. What do you think we can do to keep our nurses here?
Thank you, sir. First and foremost, I want to say that the government, federal government, should engage the National, the ESCO of National Association of Nigerian Nurses and Midwives. They should engage them in discussion. Okay. The reason being that, you see, we are the one in the field. We know what is happening in the field. We need that engagement before things go down or worsen down the level we are. So that engagement, we'll be able to talk, we'll be able to understand one another, and there will be industrial harmony. That's one. Secondly, when we have the engagement, we'll be able to let them know what is on ground. For example, now, we are talking about people moving out of the country. Let me tell you, sir, we are all human beings. Even with this country, people are moving from one facility to another due to the payment, due to the welfare, not even moving outside the country this time around. People are moving from one facility to another. So government should note that a conducive environment is needed for our nurses. Another issue is this issue of remuneration. I kept on saying it, nurses, we know the workload, we know the work we are doing, but the remuneration is not commensurating with the work we are doing. And that we have analyzed severally that we are the least out of the health professional when it comes to issue of payment. Another issue is provision of gadgets and equipment to do this job. You see, Western world that we are running to, there are facilities there. We interact with them, we talk with them. Even you might want to do overwork because the job is easier. Technology is there. So the government should engage us. The government should let us talk together.
You know, this engagement, comrade, that you're talking about, engagement. Is it then, I mean, is it true? Or should I say, are you saying that the NAMN, NAN, isn't currently and actively playing decision-making roles in healthcare governance in Nigeria?
Thank you, sir. You see,
and very quickly too, because we're out of time.
That's why I said this will engage us. In policy making in Nigeria today, we are not there. And I told you the other time, talk of the cadre of professional you want in nursing. We have professors, we have PhD, other doctors, we have masters, we have graduates, plenty. But unfortunately, they are not engaging us.
Okay.
We are not in policy making. And at the same time, you cannot bob my head without my consent. So there are a lot of things. So that's why I said governments should engage the leadership of our association for better output, for better outcome, for the benefit of the patient and the country at large. If we are engaged, if we have a resolution, I know it will reduce this issue of jackpot syndrome. And if the environment is conducive, it will reduce it. So to me, I still believe government needs to engage the national leaders of our association. They are not, we are not interested in strike, but we pray that they will not take us to that level. Because nurses are noble, nurses are caring.
Indeed.
We are professionals.
Indeed.
But at the same time, we are human beings. And there is a limit to individual elasticity.
True.
So
True.
we are pleading to the government to engage us before it went the other way, which
True.
we are not happy to.
This will be a good place to end our conversation. It's like a cliffhanger, so that we can have, we can pursue this discourse, this particular line of discourse, when next we have another opportunity with you. But for now, we'll draw the curtain here. Comrade Nurse Samuel Olumide Faromi. Faniron, I beg your pardon, Faniron. I mean, thank you so much for making that clear. National Auditor 1, for the National Association of Nigerian Nurses and Midwives. I'd like to thank you so much for coming on our program. It's been a delight, listening to you talk about this. And you're quite passionate about these issues, and I can relate, I can appreciate that. Thank you so much
it's a
for coming
privilege,
on our program.
And I want to, once again, on behalf of our leaders, the National President, Commander Mama, the General Secretary, Dr. T.A. Shetima, and other distinguished
members of your association.
Yes, I want to appreciate the NTA for giving us this opportunity.
You're welcome.
We really appreciate it.
That is why we're here for you.
Yes,
we're here for you. We're here for Nigerians.
We appreciate you, sir.
Thank you so much.
And I want it to be a continuous relationship.
Indeed. Very
Thank you.
Very well. Comrade, if I leave you here, you'll mention all the members of the association. So let's just end it there.
Thank you, sir.
All right, coming up next, a look at the family as an agent of change and social development. Elizabeth Omori comes up next.